Welcome to part 2 of methods of treatment. So along with the humanistic approaches is another approach called existential therapy. And this is an approach that is often used by healthy individuals who are interested in exploring meaning in their life. And so the focus is entirely on this person's experience in the world. Obviously, it's more focused on the conscious than the unconscious or the past. And here the person deals with issues such as death, their understanding of death, what's the meaning of my life, and they think about ways that they can enhance their life by going to sort of a deeper level of understanding of their life. Cognitive and cognitive behavioral approaches are widely used, very popular, very much supported by research as far as their effectiveness. One type of cognitive therapy that's well known is Albert Ellis's rational emotive therapy. And all of the cognitive approaches really look at the ways in which distorted thinking and the ways in which we talk to ourselves or the messages that we give ourselves disrupt the way we function. Aaron Beck has also an approach that looks at this, and again he talks about the kind of self-talk that we have, the sorts of inaccurate and distorted statements we make to ourselves, how sometimes we minimize or maximize issues in ways that just don't make sense. And here are some examples. I'm worthless. Everything bad happens to me. Nothing will ever change. Well, those statements are just not rational statements, because it's just not going to be true that anything happens to you. A popular approach that's very effective is matching cognitive approaches with behavioral approaches. And so there is a type of therapy called cognitive behavioral therapy, in which there's a focus on those inaccurate and distorted thoughts, but there are also behavioral assignments that are given to clients. For instance, a client might be asked to keep an automatic thought log so that they can see about, what are the thoughts that automatically pop up into your mind in certain circumstances. The goal is to help the client to recognize and identify those irrational thoughts and to replace them with more rational thoughts. A good example of this would be the treatment of a specific phobia. Specific phobias are phobias that are directed towards one or more things, but in this illustration, the phobia is that of snakes, where a person is afraid of snakes, and you can treat such a phobia using a combination of cognitive and behavioral methods. The cognitive part would be identifying the sort of catastrophic beliefs. If I see a snake, I'm going to die. If a snake bites me, I'm going to die. If I'm in a room with a snake, I'm going to die. Helping the client to identify their thinking related to the phobia, and then working with them with systematic desensitization, in which you gradually increase their exposure. So maybe at first the exposure involves looking at a picture of a snake, and then maybe the next step might be being in a room where the snake is across the room from you, and then gradually getting closer and closer, while perhaps using a relaxation technique to keep the person calm. There's a video clip here that you can look at of a case where someone's working with someone with a snake phobia, and I recommend that you watch that. In addition to the approaches that we've been talking about, there are other approaches to therapy. These include family therapy, where someone works with the entire family to address issues that are interfering with family functioning. And so there are different approaches that can be used to do that. Family therapy is a very wide field, broad field, with a number of different approaches. couples therapy, where a couple comes in because they're having problems in their relationship, typically maybe communication or other issues that may come up like infidelity. Group therapy, where a group of people meet together who share common issues, maybe around a common problem. There may be a group therapy that includes single parents, or maybe recently divorced people, or people who are grieving. But the idea is that because the people are experiencing a similar issue, it is very helpful and healing to them to find out that their issue and their experience is not unique to them, but that there are other people who are going through it as well, and they can share their wisdom with each other. And also it allows them to have an opportunity to work on issues of how they interact with others, because their interactions within that group will give some clues about how they interact outside of the group. And then finally, there's the eclectic approach. Today, not a lot of people adhere to one singular approach, such as the cognitive approach or the behavioral approach or the psychodynamic approach. But more often, people will tailor their approach to the individuals that they're working with. And so you may find that for some people, the psychodynamic approach is more helpful. Other people might respond better to a behavioral approach. And so with the eclectic approach, there sometimes is a underlying approach that the therapist adheres to, but they use the other approaches almost like tools in a belt, picking out the right tool for the right situation. The next type of treatment is the biomedical approach, and this is related to the biological perspective. And in this approach, there are particular types of treatments that relate to the body, because the assumption is that the abnormal behavior is stemming from something that's going wrong in the body. Psychosurgery was popular years and years ago. It's very, you could think of it as sort of like an extreme treatment. They used to do frontal lobotomies, in which they severed some connections between different parts of the brain and looked at the resulting effect of that. But that doesn't happen a lot today. Psychosurgery does not. Electroconvulsive therapy also was popular years ago, much less used today, although it is sometimes still used today. And in electroconvulsive therapy, the client has electric shock applied to their brain, so much so that it sends them into a convulsion, and that is thought to be helpful. Today it's rarely used. It's used in cases of extreme depression that does not respond to medication or therapy, and it has a short-term effect. It's effective in working with that particular disorder, but the effect is not long-lasting, and there is memory loss around the events that happened just before the ECT is administered. Far more common today are the use of medications. And there are different classes of medications that we use to treat different types of disorders. Anti-anxiety meds are used, of course, to work with anxiety, and they are generally categorized as minor tranquilizers. There are antipsychotics used for disorders such as schizophrenia, some of the delusional disorders. They're considered major tranquilizers. Mood stabilizers are used with such disorders as bipolar disorder, and that is oftentimes treated with lithium, though there are times when it is treated with Depakote. But these drugs have the effect of bringing the moods to a more stable level. When we talk about antidepressants, there are different classes of antidepressants that are used today. We have the monoamine oxide inhibitors, the MOAs, that are used. They have particular food restrictions, so some of these you have to be really careful in using so that there's not a negative interaction that happens. There are tricyclics, and as is noted on the slide, there's a potential for overdose with tricyclics. So again, they have to be carefully monitored to make sure that people have the right dosage and that they're not overdosing on those. And then there are the selective serotonin reuptake inhibitors, SSRIs, which is probably the most popular and the most effective type of antidepressant being used today. Probably most popular because it has the least amount of side effects, practically no side effects. In general, the antidepressants are working to increase the presence of specific neurotransmitters. The MOAs and tricyclics are increasing serotonin and norepinephrine, and the SSRIs are specifically working to increase the presence of serotonin. There are lots of things to consider in working with people who come from a different culture than your own. You know, oftentimes people take it for granted that once you're trained to work, your work should be okay with anyone. But in reality, people present differently depending upon the culture that they are a part of. And so their symptoms may be presented in a different way. They may have different behaviors about the way that they are open to or not open to sharing with a therapist about the type of symptoms they're experiencing. So for a person who's treating people from other cultures, it's especially important to have cultural competence. That's going to include getting to know something about the culture of the people that you're attempting to treat, understanding what their approach is and their understanding is for different types of interactions. When it comes to being open about what they're struggling with, different cultures have different beliefs around whether or not it's okay to talk about things that they're going through. Different cultures have different beliefs about mental illness and the causes of mental illness. It's very, very important to understand these differences and to respect them. So it probably goes without saying that it's important, if you want to be a culturally competent practitioner, to avoid stereotyping people. It's easy to adhere to stereotypes because they're sort of a shorthand way of understanding about something that we don't understand. But stereotypes can also lead us to misinformation. So rather than rely on stereotypes, it's important to go and actually experience the other culture and to learn about as much as you can about that culture from individuals who actually belong to that culture. Another thing to consider when we're talking about psychological treatment is that different cultures have different relationships between individualism and collectivism. Western psychotherapy is built upon the assumption that individualism is a value and something that is valuable for everyone to work towards, but other cultures have a different emphasis. Some cultures are labeled as collectivists because they emphasize the common good and being part of community and putting the community's goals ahead of their own individual goals. So we have to be able to respect where they're coming from and not just assume that what we think is valuable in our culture is valuable for everyone else. Of course, language barriers are going to impede the ability to help someone. Obviously, if they can't explain to you fully the problems that they're experiencing, you won't be able to hone in and help them with their problems. Your text does an excellent job of talking about the differences among different cultural groups.